Hello, my name is Taylor Wahl. I am one of the authors and researchers within this manuscript who helped conduct and write said manuscript on COVID and health literacy.
Hi, my name is Rae Kirby, and I jumped on this project towards the end to help with the manuscript. And yeah, we have two questions for you today just to kind of encapsulate the idea of this project. This first one is, what specific findings emerged regarding the relationship between limited health literacy and the household impacts of COVID-19?
Fantastic question. So, we saw impacts for the household generally followed a similar pattern, but were reported far less frequently than the individual impacts experienced by participants. Specifically looking at the household impacts, health literacy level was the only factor with a statistically significant association. Adults within this study sample were found to have had approximately 22 individual impacts and two total household impacts of the total 92 COVID-19 pandemic impacts that were assessed. So, some differentiations in the numbers on the individual and the household level. Although both bivariate and multivariable analysis showed that participant health literacy level was not significantly associated with individual COVID pandemic impacts, health literacy level was significantly associated with that household COVID-19 pandemic impacts. And then specifically looking at limited versus adequate health literacy, there was an association with more household COVID-19 pandemic impacts on average. Because household COVID-19 pandemic impacts were reported less frequently than individual impacts overall, household impacts may be indicative of a greater burden of hardship brought about through the pandemic.
Interesting. Yeah, thank you for your answer on that. Our
Mhm.
next question here is, what methodology was used to assess health literacy and the impacts of the COVID-19 pandemic among adults in rural northern Arizona?
Yes, fantastic question. We decided to use a cross-sectional survey. Within that survey, to assess participant demographic characteristics, we adapted the 2020 National Health Interview Survey on age. For the health literacy assessment, we utilized the newest vital sign, or NVS, to determine health literacy level and numeracy skills. And finally, to determine the COVID-19 impacts, we utilize the Epidemic Pandemic Impacts Inventory, or EPII, which was developed to learn a little bit more about the impact of COVID-19 pandemic and future epidemics and pandemics to learn a little bit more about personal and family life domains.
Wonderful. Well, thank you so much for your insights on this manuscript. We're really looking forward to seeing more of the results within. So, thank you.